Welcome to this video. We're going to discuss neck pain solutions. So we'll talk about what causes neck pain and how we address it here in our office. So most people are going to report neck pain as either, just a certain spot where they have pain or overall stiffness in the neck. Some people are going to get headaches and migraines up to the back of the head and neck from a misalignment in the neck. We'll also see problems when the nerves get affected in the neck. They oftentimes will go down to the arms and hands and back in between the shoulder blades, and that's where it'll refer pain. Because not only do we have blood vessels that run up the spine and into the head and neck, but we also have all the nerves that go down from the brain and connect to the rest of the body that pass through that area. So therefore, it's a neurovascular compression that's happening in the neck. Now, what causes neck pain is frequently trauma. Trauma in the way of a motor vehicle crash, creating a whiplash injury or an injury from a sporting event. Repetitive stress will do it, or being in a strained posture. Imagine sitting in front of the computer for 6 to 8 hours. I know most of you can imagine that because most of us spend a lot of time in front of the computers. Also, reading a book with 2 pillows under your neck, being under a car, under a sink, working over an engine, cleaning a floor, all of those things put you in an awkward position, and over time that repetition can create problems. Also, we've got roller coasters which can cause whiplash. So there's lots of different forms of either macro or micro trauma that can affect that cervical spine or neck. And what happens is the bones move out of place. So when you have one bone move away from the other one, the ligaments that hold it together, they get stretched and strained. The muscles and tendons also are going to be affected. The nerves are going to get pinched because there's supposed to be a certain amount of space between one bone and the one below it. And when that changes, it gets stenotic, or it closes down on those openings where the nerves come out, and it affects where those nerves go to, and it's also going to derange the way that disc moves. It's going to stop it from moving properly and can eventually cause tearing and wearing out and thinning of the disc. And all of that leads to early onset of osteoarthritis, because you see, the way the discs live in health is that when you wake up in the morning, you're literally at your tallest. As the day goes on, gravity presses down on those discs, the metabolites go into the synovial capsule around it, and then when you lay down at night, the weight of the head and neck, or the head and shoulders, and the legs and hips pulls that spine apart, and those nutrients go back into the disc spaces because the discs are avascular. They don't have a direct blood supply after the age of 20, so they need that pumping mechanism to keep them healthy. Now, when you have a bone that's out of place, the muscles around it lock it down. That's why you get that stiffness. So when you lay down at night, although the spine is going to still pull apart and open up, that segment, that joint area, is still locked down by the muscles. So it's not going to get as much nutrition and metabolites back into it. So over time, when you take an x-ray of that area, it's going to look thin. It's going to have bone spurs where those ligaments got damaged. The disc will be smaller, and those nerves are going to get affected. So in our office, we want to address that as soon as possible, and we have gentle and specific ways that we do it. We use Atlas Orthogonal, which is an instrument-based adjusting program that moves the base of the top vertebra back level underneath the base of the skull and straightens out the rest of the lower cervical spine. We also use an instrument to make our corrections, and we use cold laser to speed up the healing. We never do any twisting, popping, or cracking. And when people hear that, they go, well, how in the world are you going to do that without twisting, popping, or cracking? The next part of this video is going to demonstrate that for you right now.